time to retire the control freaks. That's the focus of tonight's angle. It was just about this time, right, last year when people began to lose their minds, right? Remember? They were paying $50 for a $6 pack of antibacterial wipes on Amazon. They were lining up at all the grocery stores to buy carts full of toilet paper, paper towels, dishwashing detergent, bleach, and enough batteries to power a small city. Well, Dr. Fauci, he was still only a fledgling star on broadcast and cable, but you could already tell he was basking in the glow.
What's the danger of minimizing the risk of an infectious disease outbreak?
Well, I mean, the danger of minimization in any arena of infectious disease and outbreak is that you might get people to be complacent, number one. Number two, when bad things happen, your credibility is lost because you've downplayed something.
And now, 1 year and a staggering number of deaths later, we know, or we should know, the truth about COVID. Namely, the fact that young Americans have a greater chance of being killed in a car crash than dying from this virus. And then there's this truth. States with mask mandates fared no better with the virus than those without mask mandates. And we know that lockdowns, they don't change the cycle of the virus either. Just look at California and New York versus Florida and Texas. We know that kids kept out of school suffer greatly. The isolation, the loneliness has driven more teenagers to take their own lives or overdose on drugs. We know that the schools that have stayed open, they haven't become super spreaders. Parochial schools with smaller budgets than public schools somehow managed to keep their kids in the classroom. And they kept everyone safe with some creativity and some simple protocols. We know this virus is especially hard on those who are obese, diabetic, and hypertensive. But if you were watching The Angle last spring, you already knew that. We're going to learn a lot about obesity, heart disease, hypertension, diabetes. All of these things made people much more susceptible to having a serious complication, even comorbidity. Your patient's preconditions when they come in, and that they already have underlying conditions, many of them. Obesity being one, and a high BMI. Well, we know that we have therapeutics such as inhaled steroids, azithromycin, simple over-the-counter meds like vitamin D3 and zinc that also boost our immune systems. And we know that our FDA has in many ways failed us by not allowing for the use of ivermectin and hydroxychloroquine, both of which are used around the world to reduce COVID hospitalizations and deaths. But thanks to former President Trump, we have vaccines, which millions of Americans have already received. The CDC now estimates that 83 million Americans were infected in 2020, which means they're protected by the antibodies and are unlikely to develop COVID, at least for the time being, because of their innate immunity as well, T-cell immunity, you bet. So it wasn't surprising to see this headline today. In Illinois, they just had the lowest one-day death toll since September. Florida saw its lowest hospitalizations since September. And Arizona, COVID charts are looking good across all metrics. And in Hawaii and Wisconsin, even more good news. The data are what the data are, right? We're currently seeing the slowest spread of the coronavirus since the pandemic began. But what's the CDC's response? More guidance disconnected from reality. You've gotten the vaccine and now you think, wow, thank goodness I have the vaccine. I'm home free. Well, think again, because apparently it's masks forever.
When fully vaccinated people are visiting with unvaccinated people from multiple households, everyone should wear masks and physically distance and meet outdoors in a well-ventilated space.
Wait. We're closer to herd immunity. We have more vaccinations. We have a lot of people with T-cell immunity, it's innate immunity, and the CDC still doesn't think we should be free?
Everyone, whether vaccinated or not, should continue to avoid medium and large size gatherings, as well as non-essential travel. And when in public spaces, should continue to wear a well-fitted mask physically distance, and follow other public health measures to protect themselves as others.
Okay, this is completely insane. And it's the reason we still see people wearing masks while driving alone in their cars. The vaccines were sold as a way to get our lives back, but obviously that's not true. Of all the public health officials, though, who have been consistently wrong, former Biden COVID advisor Michael Osterholm is in a category of his own. Now, recall, he's the one who consistently claims that we're in the worst weeks of the pandemic. And he never does a mea culpa when he's wrong. He simply keeps repeating himself and doubling down on doom. And now, as millions of Americans are getting vaccinated, this was his big pronouncement.
You know what? You wouldn't catch me tonight in a crowded restaurant somewhere, even with my, vaccination.
Good. Stay home, Mike. More room for the rest of us at the restaurant. Too many of us, though, have lost our ability, or maybe the will, to think for ourselves during this time. Sometimes we've abandoned common sense, and instead we adhere to the edicts of an expert class that is neither expert nor classy. Their rules and advice keep changing. It was 15 days to slow the spread. Now it's closer to maybe 15 months. Last summer, Dr. Redfield said masks were as good as vaccines, and if we wore masks for about 2 months, it would basically be over. Instead, cases spiked. And just for old time's sake, let's remember the wise words of Dr. Fauci 1 year ago today.
There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is.
Of course, he later did a 180. It's all for noble reasons, though, right? He went from no masks to you must wear a mask to you must wear 2 masks. It's time for us to break free from this cycle of failed experts and, frankly, unconstitutional orders. If you're trapped in a blue state that won't open up, that denies the data and the science, that bows to the teachers' unions, it's time to get up and either leave altogether or get involved in politics on the local level, on the state level, in any way you can. A year later, it's time to retire or just ignore the control freaks. It's time to declare victory and move on. And that's the angle.